And the purpose of the day is to have a southeast-wide healthcare science conference where we're bringing lots of scientists together from 6 integrated care systems across the southeast to one great conference. So there are 2 things I'm hoping for today. Firstly, we have a range of very engaging speakers who are going to be talking to us on a whole range of issues such as staff retention, accreditation and registration of scientific services, ethics of artificial intelligence implementation in medicine, and we have some keynote speakers giving some talks about their own careers and developments in healthcare science. And secondly, of course, it's really important that we get all of our scientists together in an opportunity to network with one another, to share ideas and look for opportunities to collaborate in future.
I'm delighted to have been speaking here today at the Southeast Healthcare Science Network Conference. I feel that there's more to come from the healthcare sciences in Kent and Medway. We have a huge challenge about how we will meet the demand for services going forward, and I'm always looking for ways in which we can bring in the talent of the widest possible community.
I found the whole morning absolutely fascinating. It's been really interesting, but I think in particular it's that healthcare scientists underpin at least 80% or more than 80% of the decision-making process.
I'm hoping to learn a lot more about the field of healthcare science and find new ways in which I can develop my career.
And I think it's the opportunity to having networked together and that sense of community in all of us being here today together.
Really enjoyed the AI panel discussion and how it links into healthcare science and the future of our profession.
The talk about the retention of staff. So I was quite interested by the statistics and what steps we can take to retain staff.
The thing that I always reflect is that there's so much to do in the NHS and in improving healthcare that we need everybody to play their full part. And there's a huge contribution to come from healthcare scientists, not least because healthcare science careers span such a very large number of areas. So I'm really happy to have been here with such a diverse bunch of people talking about how we all work together in a multidisciplinary way.
So the National Programme for Healthcare Science is led by the Office of the Chief Scientific Officer by Professor Dame Sue Hill, and I work with Sue very closely. And we're really keen to do what we can to lever healthcare science to help transform healthcare by bringing in more research and innovation and to drive high quality and sustainable science for our patients and population. And so for the delegates today, it was important they could come along and meet with us, talk with us and listen to the vision for healthcare science for the future and to contribute.